And today, I'm really excited to have Sumitra and Praful with us. They are both from Vamstar. I first encountered Vamstar when I came across their ESG report, where they have looked at a lot of different tenders and analyzed the ESG requirements in those tenders for healthcare, and concluded that ESG tenders are on the rise in general when we're looking at tenders, but also that there's some ways to go for it to be fully implemented, and there's a lot of discrepancy between one market and the next. So I was really excited when they both agreed to come on the show, and looking very much forward to this conversation. So without further ado, Sumitra and Praful, welcome to the show.
Yeah,
Thank you.
thanks, Frederik. Yeah,
I was
great to be
thinking it
here.
would be great if you would introduce Vamstar. What is it you're doing at Vamstar, and how did you end up working in Vamstar? I know Praful, you founded the company, so maybe you go last, because that
Hmm.
I
That's
think that
correct. Yeah.
journey is going to be a bit more fitting.
Yeah,
Sure.
hi. So I'm Soumitra. I joined the organization roughly 3 years back, wherein early days for Vamstar, wherein we were setting up the AI platform on procurement tender based procurement, basically. And we are using AI as a technology to scrape through several millions of documents. And through that, we were using that for market intelligence, and that's where we started building the market intelligence and consulting capabilities on top of that. Uh, we worked on several areas, including the one in ESG, which we'll discuss in this call. And yeah, Rafal.
Cool.
Yeah.
Nice.
No, really great to meet you, Frederick. And again, a very quick background in being in healthcare 20 odd years. I'm pretty passionate about how people in our industry and various teams that are helping access the information relevant for commercial decisions. Something both from the buy side of the dynamic, so how procurement teams make decisions, and also how suppliers bring that value and evidence to the table. This process is very, very manual, and I had first had experience of dealing with these things, and I thought now with before all the advent of AI, we could actually build tools and capabilities that would make things easier. So we started the journey with capturing millions of tender documents, tendering from various sources, and then eventually started to gravitate towards utilizing this information for very specific purposes, such as understanding where the value orientation is in the market, how trends like ESG and adoption of ESG taking place from actual contracting point of view, and can we provide the right tools for teams to track this as various countries and governments go and attack their climate change goals. That's kind of a little bit of overview of what is Vamstar and what we are trying to do.
Amazing. So, if I were to summarize for our listeners, Vamstar is a consultancy that is leveraging AI to provide data-based insights for commercial decision making.
Mhm.
Exactly.
That's super cool. Thanks a lot, Praful. Thanks for being on the show. Um, when I came across Vamstar for the first time was when I got exposed to your ESG in healthcare tenders report, and I remember finding it extremely interesting. First of all, because some of the findings and conclusions were not aligned with our own findings and conclusions. So that was, of course, one of those where when you face um, proof that your assumptions are wrong, it should definitely be a case of curiosity. So I've been really, really excited to have you on the show and to roll out some of those findings, because I think in at least with our customers at large and with the public actors that we're engaging with in Green Innovation Group, there's a very uniform perception that when you're looking at the healthcare sector in Europe, and you're looking at who's the most ambitious on sustainability, all fingers are pointing towards the National Health Services in the UK, the NHS, and their decarbonization strategies. when commercial organizations are reaching out to us and contacting us, a lot of the time it has to do with either they're saying we're in the UK and we don't know how to respond to the new requirements coming out, or they say we're not in the UK, but the buyers in our market are orienting themselves towards the UK in order to figure out what kind of requirements are they going to put in the tenders. And we don't know how to respond to those if they follow suit to what they're doing in the NHS. So that's sort of the general picture that we're seeing. We're also evaluating the evergreen criteria that are put forward by NHS, and then we're assessing different pieces of legislation and different tender texts, and seeing that overall, from our chairs at least, we have not looked at anywhere near as many documents as you have. It looks as if the NHS in the UK is the most ambitious and the most sort of at the frontier, the most pioneering market. But the data from looking at the tender texts, and I realize this data is from 2022, if I remember correct, did not suggest that that was the reality. And I think that is just suggesting that there's something more at stake here, that there's also a case of positioning and representation at play, where, of course, after Brexit, it's been possible for NHS to position itself differently because they don't have to abide by the same tender legislation from not being part of the EU anymore. But I would just love to dive into the data. So maybe it would make sense if you would be so kind to introduce the report and let our listeners know what is it all about, what's the headline, what's the main findings in there.
Yeah. Maybe Sandra, do you want to go first then?
Sure. Do you want to share the screen, or it's like I should be like, yeah, I think so.
Would be lovely with screen sharing, I suppose.
Or we can talk through the trends as well, Sumitra. I think so.
I think that would be better.
Yeah, because this report obviously was done for a very specific purpose, right? Yeah.
Exactly. That's what I was. Yeah. So I think just to give you a highlight. So the objective of the study which we did for MedTech Europe was to understand how ESG criteria is being used in tender documents or tender-based procurement across Europe. So we looked at 21 countries across Europe in terms of what they have been including as a language. And one of the key observations which started was that the language used for ESG criteria is very different across each country, each buyer even. So it's not just province or a country. Even at a buyer level, the language use is pretty inconsistent. And that's where the challenge was seen. And we started using AI to extract.
Can you bring forward some examples of where these inconsistencies were?
Yes, of course, I'll do that. So, for example, if you see in certain countries, they use eco labels as a common language, like it's something to kind of a certification of eco labels. In certain countries, they're talking about ROHS, which is in terms of hazardous materials clauses related to that. Certain countries are focusing more on the let's say electronic let's say batteries. There are restrictions on that component of it. So it's very different in terms of what are the objectives each country or a region has to define what environment like sustainability means for them. So so that's another element. But apart from that, it also depends on the product category. So certain countries are very stringent when it comes to, let's say, diagnostics, diagnostics or diagnostic wastes. Some countries are pretty strict on single-use products. So that's another type of this thing. Certain countries are putting more on the packaging side. So it's very subjective currently, and there's no consistent language used across. And that adds to the challenge for the suppliers because since every country is following a different norm, uh, you cannot adhere to all of them. So that's where the challenge comes from a supplier perspective. And as an industry body, MedTech Europe was trying to see how that could be addressed over a period of time.
Yeah, basically you see that there's a very high variance both in the terminology, market by market, category by category, but actually also in terms of if we look at sustainability as ESG or as segmented into ES and G for environmental, social, and governance,
Yes.
within each of those three categories, you're also seeing an entire world being folded out,
Yes.
and then seeing that spread out across markets, and on
Yes.
top of that, spread out across categories, and
Yes.
spread out across types of buyers,
Correct.
meaning
So,
that
so
that's extremely complex
yes.
map.
So if the way we finally observe was that there are objectives which are different at the top layer. Then there are differences in terms of the product categories, where we see a lot of variance. Then we see the buyers, or the regional requirements. So that could depend on what the local industry is demanding in that particular country. Uh, these are the three top layers in terms of the language which is being used, and that's how we categorized itself. Also, another layer of variance was that in certain countries the preference is towards mandatory clauses, wherein you cannot participate into a tender if you don't meet a requirement, while others it's used more in terms of scoring the while evaluating a player. So that's why they have value adding criteria or the competition clause, which they are terming it as in their tender documents. So that's how the tree structure typically works, and that's why the level of variance is quite high.
And another insight which I'll add on this, which might be useful, is which we observed is when it comes to legislation and how that legislation is translated by local and regional and national bodies in designing the tenders, there are huge variations in there. For example, take this idea of packaging made of greater than 80% recycled materials. The definition is so vast, and it varies from example from the Nordics, which are very strict about this, to the point that the points that are being awarded for this is 30, 35 plus points in a 100-point tender. And as Sumitra highlighted, you can be disqualified if your packaging is not adhering to that standard. Whereas the European legislation on this specific topic is pretty loose. It is because it's still a developing legislation. So we find this very unique that every buyer is interpreting the requiremms or the mandate of the law as they deem fit for their local condition, which poses, as Sumitra highlighted, a massive challenge for the industry because if it's a qualification criteria and they do not adhere to that criteria, chances are they won't be able to participate in those contracts.
Yeah.
And worse for the buyers, they will not have access to those technologies and will have shortages because of directional shift in ESG that they have undertaken without involving the suppliers into this equation.
Yeah, I think it's also one thing that where definitely our viewpoints and our line of sight is very aligned, is that there's a huge variance and there's no consolidation in terms of what our suppliers being asked to provide from the market. We've seen in Switzerland some 661 sustainability indicators in tenders, more than 200 in France. In France, seeing the weighting in the tenders going up towards 15% in the near future, but without any market having cracked the assessment nut. You can say that it seems as if, as you're also saying, it's either mandatory requirements that are coming in, or if they're being scored, it does seem like it's difficult for the purchasing organizations to develop a good way of assessing and scoring and applying this up towards 30% weight on anything, unless they put out somewhat seemingly objective criteria, like it has to be more than 88% recycled content in the packaging. But then figuring out what does recycled mean where becomes a challenge. And American organizations abiding by American law will have one standard, whereas a European organization will have a different standard. So I think that that observation definitely rings very true to what we're seeing, what we're hearing from the commercial organizations. If we're looking into, I mean, I think no one will be listening to this podcast if they don't already buy into the importance of ESG in healthcare and the importance for us to address climate change and greenhouse gas emissions at a global level. So I don't think we need to dwell too much upon that, but I would love to hear more about what findings you had on ESG requirements. So now we know that the language is differing immensely. There's a huge degree of variance in terms of tender requirements, and that this variance comes across the levels of stakeholders, the product categories, but also on the sustainability indicators in the tenders, they vary quite a lot. Did you find anything else on the ESG requirements?
Yeah, so it varies, like I said, varies by country and province a lot. And what we observed was that, for example, there are countries where there are several tenders, and this addresses the issue of how important the ESG criteria currently is there in that country. So the weightage, the number of tenders that have ESG criteria versus how much weightage they give to that ESG criteria. So those are the two elements to it. So there are certain countries who are giving more, there are more tenders which have, let's say, 5% weightage given to the tenders. However, there are other countries where they have smaller number of tenders which have, let's say, 30% or 20% weightage given to ESG. So that variance, like I said, it depends a bit on the product category, on especially because of the local industry which they're looking at. But there's a significant variance. So, for example, if you see France, Spain, they have more number of tenders which have ESG criteria mentioned in that. So they're the front runners in that sense. But there are countries like in Nordics wherein the weightage of ESG criteria is fairly high compared to other countries. So they are going up to 20-25% weightage being given. And we also observe that in Germany, for instance, there are very few, like the percentage is much lesser when it comes to the number of tenders with ESG criteria. But in certain product categories, they are giving weightage of almost 30% to ESG criteria. So that's what we looked at in terms of this thing. And with also, let's say, look at UK. From the time they have started to introduce the social impact criteria, that's the weightage given to social impact is increasing. So within ESG, if you see, E and S are getting a lot more importance over a period of now gradually going up. However, in terms of current state, they have a bit of a catching up to do when it comes to weightage given to ESG. That's my observation, Praful, if you want to.
Another insight that might be useful for the listeners as well. So between the E and S, so this is where a lot of divergence we see. So for example, when it comes to S and G, the specific elements, so social and governance, UK leads the rest of the European heartlands by a mile, because they have social value contracts embedded inside the definition of how a specific supplier is assessed and that specific product is assessed. Now, but here it gets very interesting. In
And
the
how
social,
can you attach a bit on how do they then assess it on S&G?
absolutely, that's what I was about to dive into. So in the social side of it, what UK has done is they have fighting climate change and recovery from COVID-19 as one of the metrics that is being defined. So now they're borrowing certain environmental elements into the social contract or social value, and defining it, which further muddies the water between E and S, as you can imagine. I think the UK's main aim, or at least the bodies in the UK, and I should clearly say there's a difference between NHS in the England versus the devolved nations. Everybody is doing different. I know you're referring it to the UK for keeping it simple, but specifically in the England, for example, the social value construct where they are putting a lot of emphasis on suppliers to have climate change targets embedded inside their supply chain. So, for example, today, if you are using such as things like delivery of specific products to a specific NHS site, you need to have a mandated carbon count, and then you need to have a target for a carbon reduction to that specific site. So, for example, if 5 trucks are going to a specific CCG delivering goods, then you need to have a plan about how
What's
that can be minimized. It's like a clinical commissioning group, the old word for the way commissioning was done in the NHS back in the day. They still exist, those trusts, for example, and then supplier needs to have a mandated plan about how they are going to reduce that carbon footprint in the next 3 to 5 years, thereby enhancing the social value, which I think is a deep construct in the sense that it's really taking the environmental factors and driving some of the social contract that exists. And second important thing is within the social settings, we are seeing how a specific product that the company is bringing is adding value to the local economy. So are local jobs being created? Are more, for example, green investments being made into recycling plants and recycling apparatus? You have to now provide evidence into your bids as a part of the social value contract, which poses significant, for example, questions for suppliers. So they need capabilities, they need a very granular understanding of the tools and what others are doing in the market to have a concrete plan for showing the value which they have today to offer to the buyers, and then having a plan of meeting the targets that the buyers have set, which is very different to some of the countries like in Europe, where they are heavily banking on decarbonization and more on the environmental standards, such as, for example, recent legislation in Europe around chemicals of concern, which is another topic of interest in the ESG space. So there is huge divergence between how countries are taking the ESG buckets and using it to drive their climate agenda.
Yeah, for sure. No, that resonates quite a lot, and also thanks a lot for highlighting some of the differences in performance and application in the UK and the EU. If we're looking at regulatory and policy changes, one thing that's on everybody's lips right now is the CSRD and the CSDDD. If you were to give sort of the Vamstar take on that for the healthcare sector, what is it you are seeing from your point of view here?
I think specifically for the purposes of the study, we didn't dive into that aspect more. I know we did get some questions recently on this topic, but yeah, it's something still we didn't find a lot of evidence inside the documentation that we looked at of the specific legislation you're talking about. Because if you look at the study that was done, it is done on the basis of interpretation of that evidence of that regulation translated into a specific requirement for that supplier. Mm-hmm. So we are capturing what's happening at the implementation layer rather than at the actual text of the policy or the of the regulatory setup that's actually there in the country, because there's usually a gap between the theoretical view of a policy and a regulation and its actual language inside implementation.
Mm-hmm. I think that that's an amazing point to bring forward. Also, that of course, since you're reviewing historic data, you're looking at the tenders from 2022
Yeah.
and looking at them as their entirety. You can say it's probably possible to say, well, we know what was being asked in 2022. This year, maybe we would be able to know what's being asked in 2023. When TSRD is coming into place, we will also be able to see if this actually has an effect. Are we seeing a consolidation in tender requirements that is more aligned with the new regulation coming out and the new policies that are being implemented? So I think that would probably be an interesting question to ask 2 or 3 years down the line, to say, okay, what then happened? But I also think it's something that's quite relevant to put forward for tender specialists, both in commercial organizations but also in public organizations, to say, hey, now we have these policies in place. So, wouldn't it make sense if we looked at how might we consolidate more, make these requirements less region specific, less municipality specific, even when it's all the way down to sort of a city level, and try and sort of streamline some of those requirements a bit, so that it becomes less cumbersome to report and easier to act and enable action and speed up the actual transformation.
Yeah, so
Absolutely.
On that note, one other thing which we also looked at, we mapped the countries and the regions in terms of the policy framework, in terms of how stringent is the policy framework versus the actual implementation. And we observed that certain smaller countries struggle a bit more in terms of implementation. The reason being the market is a bit small for them to have attract suppliers to their markets, because that's the other challenge which most buyers face as well, wherein they need to have a consistent supply and they worry about the shortages. So they cannot potentially implement many of the policies as effectively as some of the larger markets where there are more volumes, and suppliers will obviously be attracted to those markets for sure. So
And it's also one of the things you will hear Nick Watts, the head of sustainability in NHS, say, that if you're not complying with our requirements as a supplier, somebody else will. So they're actually big enough to say sink or swim. But for smaller markets, that might not be possible. If you're doing purchasing in Iceland, for instance, representing some 500,000 people, that's a bit more difficult to take that position.
yes,
Yeah.
and
Absolutely.
that's another reason why some of the smaller markets they are trying to have regional standards implemented, and that's why they are vouching for those a bit more than some of the larger markets, wherein they are, and that's why they are in front runners. It comes to the policy implementation side. However, when it comes to the actual implementation, there's a larger lag when it comes to actual implementation.
Yeah. So also, just to kind of add a little bit point on this. So if you look at today, the feedback loop from regulatory side to, or policy regulatory side to implementation, and then back into policy reframing, and we find that there's this concept of something called as regulatory gravity. Now, regulatory gravity is the size of your country and the type of setup you have, such as, for example, the NHS, where the power is, so to speak, consolidated, and large changes can be made, which will have a full impact on the market. We find that because the regulatory gravity is so strong, these tend to be slower in terms of policy to implementation. So they take time to make big changes. But when those changes are made, they apply to wider markets, and suppliers usually end up complying with those regulations and standards because they have to survive. Like what happened with carbon emission of cars and automotives, a couple of years ago. But when it comes to smaller countries where regulatory gravity is either spread out or because there is less power embedded in, often what we see is that there is usually this dialogue between suppliers and the regulators about what should be the shortest possible course of action. And this is where I think the misalignment in policy starts to take shape, because now you have different uh, agencies and local bodies that are trying to impact that change at the local level, but they don't have that gravity to pull all the suppliers in. And that's why you have this fragmented space. So some of the dialogue that at least we are seeing now in 2024, and I think you brought up that point previously that the study was done 22. So we are studying now on a yearly basis and quarterly basis also trends that are shaping up this feedback loop between policy implementation and regulation text. Now, this is something very critical because this dialogue right now is happening from an EU's perspective at the EU level. Maybe there is a mandate that the EU takes and at the Commission level it drives down. And similarly, that dialogue now is happening also in the UK from individual organization levels like Department of Health in England and in NHS in Wales about how do you drive that alignment from implementation to policy on a continuous basis.
And how is that? Thanks a lot for sharing that, Praful. If anyone who's listening to this would want to access it, is this something you make publicly available, or is it something that you need to discuss and gain access? Or how are you distributing this knowledge?
Yeah, I think right now all of our work, specifically is a specific line of products or specific, let's say, departments within a company, because it's often suppliers are first wanting to understand how the baseline is changing and evolving, and second, do we need to make supply chain changes at the moment to really stay ahead of this? Otherwise, they'll be caught. So it's all specific work to a specific supplier company or specific category. But we are looking at opening up some publications which will be available to the wider kind of industry participants to have a dialogue between industry and the buyer and the payer stakeholder.
Nice. Okay, so currently it's not public, but it is something you can reach out to Vamstar and try and see if you can set something up to acquire those insights.
Indeed.
Really, really interesting. And I think it is very clear for everyone to see that a lot will happen on this agenda, both in the short term and the more distant future. What we're seeing right now is that the tectonic plates are in motion. They have yet to fall into place. And the consequence of that is that tender requirements, ESG requirements are occurring sporadically across markets, across product categories, and across buyers. And that means that the language is quite different. It's quite inconsistent. It is not consolidated, putting a large strain on suppliers because they have to abide by a multitude of different requirements that are asking for the same thing in a multitude of different ways, and giving different weights and different scorings across the different tenders and geographies. Then we're looking at the UK and the EU, where we're seeing that the UK has a more firm grasp on implementing ESG. There's a relatively large scale plan in place that's being executed by the NHS, where social and governance is also playing a significant role in the evaluation criteria, looking at how it might provide social and governance value in the local context where the tender is going on. And then looking at the regulatory and policy changes for ESG standards, where you have built a system of evaluating this more live on a quarter-to-quarter basis in order to analyze trends and seeing what's going on. And I suppose it's safe to say that you are seeing a development, that things are happening and they are happening at a certain speed. Are you when you're reviewing that data, considering that the semi-public study you did is on 2022 data, comparing to 2023, what's the or to the second quarter of 2024, what is the key development that becomes evident when you're comparing those like for like?
Yeah, so
Yeah.
when we look at, so we have been looking at the market till current in terms of what's how the implementation of these policies is happening on the tender landscape and what's the policy framework. What we saw was between 2022 to 2023, this was a sample-based, of course, approach, wherein we looked at there was a annual growth of around 7.5 to 7.6% in terms of number of tenders that have included ESG criteria into their uh, tender documents and evaluation frameworks across Europe. And this varies between countries and countries. So in UK, we are seeing a much steeper growth ever since 2021 onwards, wherein we are seeing kind of a hockey stick kind of a growth rate in terms of number of tenders that have that. Similarly, there are other markets which are increasing the percentage evaluation criteria slightly more. Uh, for example, Spain has increased the weightage criteria, and we are expecting France also to have that 15% limit into the tender documents. So, so there are two elements. One element is the number of tenders that will have ESG criteria, that is increasing for sure at a rapid rate. Also, the weightage is also increasing in terms of average weightage given to ESG criteria across these. So we are seeing a much higher, steeper rise right now.
Yeah, and just to also add some context to this as well. So, as I said, the concept of this regulatory gravity, right, where big blocks are often slower, but then they actually start making those changes. But when they make a change, that change is pretty big. Now, one example that we saw and happen between 2022 and 2023 is with Germany. So
Yeah.
in Germany, we noticed that up until 2022, it was a massive laggard in ESG because they were still looking at the neighboring countries, the landscape, the geopolitical issues that they were dealing with. And then in the January of 2023, they changed the whole game. They launched a reform, especially how the environmental standards are implemented for key buying organizations, and that changed the complete game. On top of that, this year, 2024, there is a talk where they are going to change the financing of hospitals and buyer landscape in Germany now, which I think should go live anytime, which will completely decimate the existing way they buy things and suddenly put ESG at the center block of all of this. Which
Wow.
means Germany by 2025, if you look at a trend, would be the leading country when it comes to ESG implementation.
Wow. That's a huge deal. That's a
It's a
huge
huge deal.
deal. Amazing. Yeah, I think that's probably the best cliffhanger to wrap things up on. What a way what a way to end an interview. The biggest market in Europe is shifting gears. That's really interesting. Thanks a lot for coming on the show, Sumitra and Praful, and sharing your views from Vamstar and the ESG analysis that you've done on analyzing healthcare tenders from all over Europe. This was super insightful. Yeah, I just want to thank you for that.
Yeah, thank
Um,
you.
for everyone listening, please do remember to like and share the show. In 2022, we were amongst the top 5 most shared podcasts on Spotify. So please do continue sharing, so this knowledge comes out and provides value for everyone who needs to hear this in the healthcare sector. Signing off, my name is Frederik Van Deurs. You've been listening to the Sustainable Healthcare Podcast. You can listen to it wherever you get your podcasts. Thank you for listening, and have a good one.